Upfront, fertility treatments like IVF are so expensive, they can really be out of reach for lots of couples. Well, what if you could have a new kind of fertility treatment for free? Well, joining me now to explain is Dr. Jesse Hade. Good to see you, Dr. Hade.
Thanks, Steve. Nice to meet you.
So talk to me about what you're doing, because it's something called IVM, which is different than IVF, right?
Right. Well, IVM stands for In Vitro Maturation. It's a similar process to IVF, or in vitro fertilization, but here we're not maturing the follicles. So we're taking out immature eggs from immature follicles and then doing what Mother Nature does inside the laboratory.
So how is that different? Like, for the layperson, what does that mean for someone who's looking at the two treatments?
So there's three differences. One, there's little to no medication with in vitro maturation versus in vitro fertilization, where you have to take at least 8+ days of injectable medication.
Which a lot of people don't like doing.
Exactly, and that adds at least 30% higher cost to the cycle itself.
Okay.
It's more invasive, IVF, because you have to constantly draw blood to monitor the patient's response to the medications, which you don't have to do in vitro maturation. And thirdly, it's
cheaper.
It's less expensive.
Less expensive, right.
Well, in this country, in vitro maturation is still considered an experimental procedure. So there are only a few centers that are doing IRB-approved study protocols to investigate this technique. However, in other parts of the world, and specifically in Korea, where this technique is really developed and refined with Dr. Lim, has been very responsive here. So because there's few centers that can do it, and because it's technically much more difficult for me as a physician doing the retrieval, and also for the embryology lab to cultivate and grow these immature eggs to maturity and fertilization, those extra 2 days in the petri dish make a big difference in outcomes. So most centers are just not successful in doing it.
Right, so it takes a specialized centers. There are a handful of places in the U.S. that are doing it. Is that basically what it comes down to right now?
Right now, that's what it is.
Okay,
right.
So over 5,000 babies born successfully with this method, right, internationally.
That's correct.
And they're doing it here in the United States now, but under clinical trials. Why is the United States so slow to catch on to these things? I mean, that's a lot of babies.
Well, you know, if you look at IVF, there are over 1 million babies, so you want to look at the safety of a procedure before you start saying that it's equivalent to the way things are done conventionally here. So because of the fact that in vitro maturation, there's just not enough data. If you're going to look at birth defects in an offspring, you need about 10,000 patients to show that there's a difference. With only 5,000 babies, that's still not enough, and that's why the U.S. is just cautious, and they want to make sure that if people are getting treatment in the United States, that it's under the best possible circumstances and care.
Okay, people can actually get these treatments for free now through your clinic?
Right, so what we've been doing, because of it's a study and it's not offered to the general public, we've completed 10 trials so far. Of the 10 patients who underwent the procedure, 8 out of the 10 are pregnant successfully.
Wow.
The other spots, we have 3 other patients that are starting treatment, and we have 7 spots that are still available.
Okay, so how can people find out if they're eligible? How can they reach you and get online, so to speak?
Well, they can just go online directly at our website, newayfertility.com, or call the office and make a consultation to come in and see if they're eligible.
All right, Dr. Jesse Hade, sounds like some exciting stuff for a lot of folks out there. I hope they'll take advantage of it, because it can be super expensive. Thanks so much for coming in.
Thank you.